Good morning, good morning, good morning, or good evening, good evening, good evening. I'm Dr. Tracy McClellan with the Medical Institute of South Georgia. Of course, you know who I am. And I am here to talk about Chapter 5. But first, I just want to touch bases with you, find out how you are doing, and let's talk about your preparations for each chapter. What I've mentioned in the past is everything in your textbook has already been decided or has already been reduced for a short course like the one that you're taking. Everything is important. So, sometimes when you get an assigned reading in some textbooks, you have to read the paragraph before, the paragraph underneath in order to understand the paragraph in the middle. And the paragraph in the middle is the most important. In this case, in your textbook, everything is important, even the little boxes on the side, and you may need to read the content more than once. So if you're not pulling yourself away from the other extracurricular things in your life to give yourself that privacy, true study time, you're going to find yourself not doing well on these major exams for each chapter. You really have to read the chapter, highlight, make little notes to the side, reread the paragraph again to make sure you understand and that you got it. So that when you read the questions about the information, you can actually select the best answer because you know it. So if you're not truly, if you're just reading itself alone is not studying. Studying is reading the paragraph, thinking about it, rereading it again, or reading the whole page and thinking about it. And when you get to the end of that particular topic or that section in that chapter, you may have to go back and scan through that again and then take notes to the side. That's how you study. Just reading it is not studying. And that might be, if your grade is not the grade that you want on your exams, that may be the cause of it because you're not putting enough time into studying the material. Everything that you're seeing on your major exam for each chapter, this is the type of content you're going to see on your state exam. So if for some reason you're not getting it here, when you get to the end, you won't be ready for the state exam either. So you're going to have to go back and make sure you're spending enough time with each chapter prior to taking the state exams, prior to taking the major exam for each chapter. Okay. All right. So work on your study skills for your tests. That's going to help increase your grade overall. All right. So let's get started with chapter 6, and this is personal care skills. I'm going to share my screen, and let's see. Well, I don't have it pulled up. Let's see, where is it? Give me just a minute, see if I can get that pulled up for us. I'm going to pause my recording for just a moment. Okay, so let's see if I can share my screen, and we will get started with chapter 6, personal care skills. Thank you for your patience. All right, what's happening there? From the beginning. Okay, chapter 6, personal care skills. Here we go. All right, so the first thing we want to look at is hygiene. When we talk about personal care skills, see, as nurse aides, you will be taking care of patients at the bedside. You will be assisting with baths, wash-offs, hair, grooming, nail care, foot care. This is the chapter where we get more in depth about the personal care skills. So hygiene has to do with practices to keep bodies clean and healthy. Grooming is practices to care for oneself, such as caring for fingernails and hair. So the question is, how do we get ready in the morning? Nurse aides help residents with these same tasks in the morning. So the assisting with personal care skills, here's what you're going to be doing: helping the resident be as independent as possible. So we don't do for the resident the things that they can do for themselves. Be aware of resident preferences and routines. Always explain what you'll be doing. Always provide for privacy. Okay, and a lot of this is your before procedure actions. And then observe the resident during care. You want to note and report signs and symptoms that you see, hear, or smell, or touch. Observe the resident's mental state, report any changes, leave the resident's room clean and tidy, leave the call light within the resident's reach. So then we think about what are some other things that nurse aides can do to help promote privacy, respect, and dignity during personal care. So why do you think that performing the task is only half the job? Let's look at it. We want you to keep in mind pressure points when you're giving patient care. Pressure points are areas of the body that bear much of the body weight. And then you also have what we call bony prominences. And these are areas of the body where the bone lies close to the skin. Okay. Pressure injuries are serious wounds resulting from skin deterioration and shearing, also called pressure ulcers, pressure sores, bed sores, or decubital ulcers. All right, then you also have what we call shearing, rubbing or friction that results from the skin moving one way in the body and the bone underneath it remaining fixed or moving in the opposite direction creates a shearing force, which can be very, very painful. All right, let's see what's next. A draw sheet. A draw sheet is a tool that you're going to be using oftentimes when you have to move residents. Draw sheets is like a square shape. You take a sheet and you're gonna fold it into a square, or it may have an actual piece of material that's in the square is heavy enough, and it's used to help pull, slide a patient up in bed because maybe they can't move themselves. Foot drop. A weakness of muscles in the feet and ankles that causes problems with the ability to flex the ankles and walk normally. They call that foot drop. The actual foot actually, and rather than sitting up, it actually drops forward. Call that foot drop. You need to know what orthotic devices or orthosis is. This is a device that helps support and align a limb and improve its functioning. A device that helps support and align a limb and improves its functioning. That's called an orthotic device. When you start to care for patients and their skin, when we're trying to prevent pressure ulcers, you want to keep in mind that the key is prevention. Once a pressure ulcer pressure injury forms, it can get bigger and deeper and it becomes infected. So what the main thing your job is a part of, what we should be focusing on is how can we prevent that particular incident from occurring. Pressure injury danger zones. This is important. The side of the head, because they are lying on the side a lot. The ear, the shoulder, the hip, greater trochanter, the knees, the ankles. Prone position can be pressure injury area danger zones as well. The cheek, collarbone, breast, abdomen, genitals, knees, and toes. The supine position, back of the head, the shoulder blades, elbows, buttocks, sacrum, which is the butt bone, between the legs and the heels. All of these can be considered pressure injury danger zones. Okay, all right, let's move on. So why should every resident's skin be inspected each time that care is provided? You are looking for areas of redness, areas of tenderness. If the patient resident says something, this is itching or there's tenderness, then you got to inspect that area because that may be an area of skin breakdown and we don't want to create pressure areas or have skin breakdown. So when you're observing the skin of a resident, look to see if the skin is pale, white, reddened, gray, or purple skin. You're looking for blisters, bruises, or wounds on the skin, differences in temperature of the skin compared to the area around it, complaints of tingling, warmth, or burning, dry, cracked, or flaking skin, or itching. This is what you're looking for, or either looking for or pay attention to whether or not residents complain of any of those things. Okay. You're also looking for a rash or any skin discoloration, like with a Caucasian patient or a white patient, you're looking for a strawberry red color. That's not a good sign. We don't want that. And the rest of their skin is the normal skin complexion, and you got prominent areas that are on up under bones or on top of bones, and they're red. We got to pay attention to that. We got to protect those areas. You're looking for swelling, fluid or blood draining from the skin, broken skin areas on the body, including between the toes or around the toenails, changes in existing injury, including size, depth, drainage, color, or odor. Those are all the things you're looking for when you're doing patient care and you're observing the skin. In a darker skin patient, it may not look red, but it may appear a different color than surrounding. It may be a darker shade on that skin. It may be swollen, painful. It may be firm when you touch it, or it may be soft. It could be warmer or it could be cooler when compared to other areas in that of the skin of that same patient. So pay attention to all of that. When you have a bed-bound resident, they are always at greater risk of pressure injuries. So we want to do things to help prevent that. Some things that we can do are partial baths. Partial bath is when we just hit the highlights. They may not go to the shower or get in a tub, but we hit those key areas. Perineum has to do with the genital and anal area. So you want to recognize what that term means. Does bathing have more than one purpose? Yes, it does. So how can a nurse aide promote safety and comfort while helping residents to bathe? These are some questions to think about, and the answers are already there in your book. Spending time with that resident is going to give them some comfort. It gives them some quality time with another human being. You can talk to them, you can ask them questions, and they can talk to you and also ask you questions while you're giving a bath. Why is it important to check the temperature of the water? Because we're trying to prevent, that's right, injury, scalding, burns, any injury to the patient's skin. We want you to remember that perineal or the genital care is considered a procedure and should be done as a step-by-step technique, different for males and females. The nurse aide must turn the resident on his or her side and clean the anal area to complete that procedure when you're doing perineal care. So what is the reason for each of these steps related to giving a tub bath or a shower? Why should you check the room and clean it if needed? Why would we place all needed supplies and equipment in the room? Keep the door closed during bathing. Keep the resident covered whenever possible. These are all things that you want to keep in mind because the patient is a resident, but this is their home. You want to make them feel safe when you're giving them a bath and not feel invaded or as if their privacy is being invaded. You want them to feel safe. Pediculosis, you need to know what that means. It's an infestation of lice. And sometimes this does happen and it breaks out. You want to also think about safety razors. Is a type of razor that has a sharp blade with a special safety casing to help prevent cuts. It requires the use of shaving cream or soap. You have disposable razors. Everyone knows what those are. And then also electric razors. Grooming is a very important part of the activities of daily living. So each day, some residents will require help with brushing and styling their hair, shaving, dressing, caring for fingernails, and applying makeup and jewelry. Residents should do as much for themselves as they can. So if it's something that a resident can do for themselves, we want to put them in a position, encourage them to do things for themselves. Let residents make as many choices as possible. You want to be sensitive, be professional, and be respectful. Give nail care when nails are dirty or jagged. If the facility allows nurse aides to perform nail care. Do not use the same nail equipment on one or more than one resident. Keep the feet clean and dry. Observe the residents' feet carefully. Make sure if you give them a bath that you dry in between their toes. Make sure you dry underneath the female's breast. Don't leave that area moist. Wear gloves when you're shaving residents. Be gentle when handling residents' hair. Foot injuries can be very dangerous, especially for residents with diabetes. So make sure that you are paying close attention to their feet, especially if they're diabetic. You want to know about the affected side. The affected side is the side of the body that is weakened due to a stroke or injury, also called weaker or involved side. So today, you guys are going to be practicing dressing a client with an affected weak right side, right arm. So pay attention to the steps that are listed in your book there. The involved side is defined as the side of the body that is weakened due to a stroke or injury. So that term is a different term, but it means the same thing as the affected side. IV means the delivery of medications through an intravenous, through a vein. Embolism is an obstruction of a blood vessel, usually by a blood clot. Okay, so when we talk about assisting with dressing, it refers to the affected side as weaker or involved. Preferences should be followed. Allow the residents to choose the clothing. This is a part of the steps for dressing a client with a weak right side, or if the side is the left side. Residents should do as much as possible for themselves. Make sure you don't forget to provide privacy. You may need to use a roll or a fold down sock before putting them on. You may want to roll or fold down the sock before putting them on. Front fastening bras are easier than for residents to fasten by themselves. Put back fastening bras on the waist and fasten in the front first before rotating it around. We kind of know the drill with some of those things. When dressing, start with a weak arm or leg first. When undressing, start with the stronger side. That's a part of your state test questions, and it's also going to be on your major exam. It's going to be on your final exam, so make sure you understand about dressing the client. Oral care is us doing mouth care, brushing the teeth and the gums. Aspiration is something you need to be on the lookout for. The inhalation of food, fluid, or foreign material into the lungs. Okay, so let's go back to sharing our screen in just a moment. That's where we were. Yep. Okay, so aspiration, the inhalation of food, fluid, or foreign material into the lungs. That's not what the lungs can only handle air, no blood, no liquid, and definitely not any food. So when something goes down into the lungs that wasn't supposed to go there, like air, we call that aspiration, and it could actually lead to death. It has on many occasions. All right, let's see. All right, so let's see. Let's go back and make sure I didn't skip something. Yep, I did. So aspiration, dentures, artificial teeth. Let's talk about oral hygiene. Think about the process of performing oral care. You guys will have to be able to perform oral hygiene on each other. So we have toothbrushes for you to practice. I know it's not your most favorable thing, but you will possibly have to do that for your state exam. It's one of the skills you will have to perform. So you might as well go ahead and prepare yourselves for that. So how do you think providing mouth care for an unconscious resident is different from providing mouth care to a conscious resident? Well, an unconscious resident, you're gonna have to hold their mouth open sometimes, or just, open the jaw for them. and then provide mild care. You also want to make sure that their head is elevated because they could aspirate even though they're unconscious. So you got to keep those things in mind, those safety things in mind. Remember, even when people are unconscious, they may be able to hear what is going on around them. So be careful about what you're saying. If they have a breath odor, you don't need to be saying that out loud. Just give them, do the lemon mouth swabs to kind of help with the odor in their mouth. When do you floss teeth? Before you brush or after? After you brush, that's right. All right, the differences between a fracture pan and a portable commode. A fracture pan is a bedpan that is flatter than a regular bedpan. I'll show you guys in the lab what the fracture pan looks like. That fracture pan is not the kind of pan you're going to be using for the bedpan. Fracture pan is designed for patients who have had hip surgery. All right, and then a portable commode, everyone knows what that is. Nurse aides in terms of elimination. You often assist residents with elimination needs. You want to be tactful and protect the resident's privacy. Pull the curtain, shut the door. Residents who cannot get out of bed may use a fracture pan or a standard bedpan or a urinal if they're a male. A bedside commode is used for residents who cannot get out of bed but find it difficult to walk to the bathroom. A standard bedpan should be positioned with the wider end aligned with the resident's buttocks. A fracture pan should be positioned with the handle toward the foot of the bed. And I'll show you guys the difference in the regular bedpan and a fracture bedpan. Positioning is important, the act of helping people into positions that promote comfort and health. And then, of course, you guys all know that supine is the body position in which a person lies flat on their back. Lateral is lying on the side. Prone is lying on the stomach. Fowler's semi-sitting position. Sims, we know what Sims is, the body position in which the person is lying on his or her left side with the upper knee flexed and raised toward the chest. Log rolling. This is moving a person as a unit without disturbing the alignment of the body. Dangle is to sit up with the leg, you're sitting up in bed with the legs hanging over the side of the bed in order to regain balance and stabilize the person's blood pressure before they get up and oftentimes go to the bathroom or get up to start their day. So, nurse aides are often responsible for helping residents change positions and should remember these points. Changing position helps avoid muscle stiffness, skin breakdown. This is important. Bed-bound residents should be repositioned how often? That's right, at least every 2 hours. Okay? And here are some 5 basic body positions that you guys have already seen before. Supine position, lateral position, prone position, Fowler's position, and the Sims position. Ergonomics, you need to know what that term means. It's the science of designing equipment, areas, and work tasks to make them safer and to suit the worker's abilities, called ergonomics. Transfer belt is what we use when we're getting patients out of the bed to a wheelchair or from the wheelchair back to bed. Remember, many facilities have adopted a no lift, zero lift, or lift-free policy, and this is to help make sure that you, the care providers, stay safe when we're assisting patients to get out in and out of bed. So nurse aides must know their facility's policies and follow them carefully. We want you to also remember, before transferring a resident to a wheelchair, be sure the wheels are locked. That's a safety issue. Assisting a falling resident. So you want to widen your stance, bring the resident's body close to you, bend the knees, and support the resident. Lower the resident to the floor. Do not try to stop that fall. Call for help. Do not attempt to get the resident up. So at a facility with a zero lift policy, mechanical lifts may be used to transfer residents. True or false? True. That concludes Chapter 6, Personal Care Skills. Thank you. Remember, when you're studying, studying means to read something more than once and to take notes. You read it until you understand it, until you have the content of the information in your head, on your paper, and not just in the book. But to just say I read it or I scanned through it, that may not be enough to help you do well on your exam. So continue to prepare yourselves and continue to read and study.